Hi, I'm Dr. Brett Langston. I'm a prosthodontist and owner of Dental Implant and Aesthetic Specialists here in Georgia. And I'm here to help you watch your mouth. Today we're going to be talking about full mouth implants. You might have been doing your research or your dentist said you might be a good candidate for full mouth implants. So what does that mean? It can be kind of a misleading term. Initially, some people thought full mouth implants mean for every tooth you have taken out, we put in an implant and we restore every one of them. And there have been cases like that, but that's not necessary anymore. We found that we can strategically place a specific number of implants in each arch and build a full set of teeth on those implants. So when it comes to full mouth implants, you've got basically one of two approaches. If you're making something removable, which is like a denture that you take out at night, once you take the teeth out, you can put at least four implants on the top and four ideally on the bottom, and you can build a denture that has snaps on the inside. Once the implants have healed, we put little custom gold attachments on them that stick through the tissue and allow the denture to snap into place. And so it's a great significant upgrade on the quality of a conventional denture, because instead of working with tissue and tongue attachments and worrying about stability that way, it actually snaps in and locks onto those implant attachments. And the nice thing is they're very customizable. So the implant obviously stays in your mouth. You've got a little gold piece that comes to the tissue, and on the inside of your denture, you've got a little snap with a rubber attachment. And so with those four attachments, when you put it in, it snaps into place, stays in all day long. You can talk, eat, sing in your choir, do whatever you want to do, and at night you take it out. But over time, the system is designed so those little rubber snaps can wear a little bit, and they're fully interchangeable. You come into the office, we can switch them out, change them real quick. They go from only 1 pound of retention all the way up to 8 pounds of retention. So when we start out, we always start really light, because if we put too much retention in there, patients can't get it out. And so I know it sounds like a good problem to have, a denture that doesn't come out, but we want you to be able to take it out at night so you can clean it and remove it. So it's a fully customized denture that snaps into those implants. Alternatively, if you're looking for a solution that stays in your mouth, something you cannot take in and out, that only we can take in and out for you, we have what's called a fixed hybrid, which is essentially the same day that the teeth are taken out, we put in implants and we put a temporary set of teeth onto those implants and we screw it into the implants. So when you leave that day from the surgery, you've actually got a full set of teeth either on the top or the bottom, or sometimes both top and bottom, that you're able to chew and function with. So something to keep in mind is that even though they look like real teeth and a full set of teeth, you can't function with them like a regular permanent set of teeth, because the implants are still healing. The bone is still growing on the implants. So the first 3 or 4 months after that surgery, anything you can cut with a fork, you can absolutely eat. Anything more than that, we want to wait until we get the permanent one on there, because then the implants are fully healed. So then at about 3 to 4 months after the implants are healed, we go through the process of making your customized set of porcelain teeth look very real and lifelike, and a zirconia bar and pink ceramic. So the whole process, when you're all said and done, looks like you've got a full set of teeth that's attached to those implants. You cannot take them in or out, and when you smile and talk and chew, it looks like you've got a natural set of teeth. This is a great solution for patients that have either multiple missing teeth, multiple teeth that are broken down, for someone that wants to have a solution that doesn't involve them taking anything in and out. There's a very valid concern and fear that people have. They have memories of their grandma or their parents even with a glass on their side table with their dentures sitting in it. And a lot of people don't want to be in that situation. So fixed implants are a solution that we have, that you can come in with the teeth that you're really unhappy with, leave that same day with a full set of teeth attached to implants. Some of the comments that we get from patients and YouTubers is, I just want my teeth taken out. And that's a valid concern, and absolutely, if you're in that situation where you're frustrated, you're in pain, you've gone through a lot of dental trauma, and you're at the point where you're at your wit's end and you just want your teeth taken out, that may be a solution. It may not be a solution. Come in, talk to us, let us kind of present you with your options. At our core, we're pretty conservative. We, as a practice, like to save teeth, and so we always want to save teeth, because we can build up and we can replace and we can do everything, but we can't get you back to where your natural teeth were when you were 17, 18 years old. So that's not always the solution, is to just take the teeth out. If we can keep the teeth and build around it, absolutely that's our default plan. Sometimes you do reach the point where your teeth have gone through destruction and wear and tear, and they're broken down, and it's caused the collapse of your bite, or it's caused dental pain elsewhere, or you only have a few remaining teeth that are great teeth. Sometimes at that point, a full mouth of implants might be the best solution for you. There are many offices that can provide you with teeth in a day, full mouth fixed implants, and there's a good chance that many offices do a great job. Something that I take great pride in here is that we plan each case very specifically. Every patient is unique, every case is unique. We start with a lot of planning. It starts with a three-dimensional cone beam scan, a full medical history evaluation, following with any of your other physicians to make sure that you are a good candidate for implants, but then also a lot of detailed planning goes into behind the scenes to make sure you've got the right quality bone, make sure we can put the implants in the right spot to support those teeth. We do a lot of homework, we do a lot of prep work so that the day of surgery, we can come in very confident that we have the best plan customized for your mouth that we know is going to work. Unfortunately, there are places that want to just get through as many patients as they can, and sometimes, unfortunately, I think a lot of things start to look the exact same, and a lot of final results look the same, and everybody has that same look, and the results are either unaesthetic or are eventually going to fail. And so one of the things that we are really proud of is that by planning ahead of time, we can prevent a lot of mishaps that happen in other offices. So one of the things that really sets us apart is our experience with not only the surgical side, but also with the restorative side of these complicated procedures. I like to tell people, you're not going to go to a plastic surgeon who does one nose job a year to do your nose job. You want to go to the guy that knows his stuff, does a good job, can show you examples of before and after, can show you, hey, I know exactly what's going on, but also somebody who says, you know what, I've had things go wrong, and we know how to fix it, we know how to plan for that. Our goal is to help you improve your dental health, whether that's something small or something large, and we're building a relationship. And I want that relationship to be lifelong. So if you find yourself in a situation where you've been instructed or guided towards a full mouth implant case, or you feel like that might be something that you're looking at or would be appropriate for you, please come see us. We'd love to talk to you, sit down, do a consultation, kind of let you know what your options are and plan out what the best roadmap for you would be. I'm Dr. Brett Langston. I'm a prosthodontist and owner of Dental Implant and Aesthetic Specialists, and we're here to help you watch your mouth. I'm Dr. Brett Langston. I'm a prosthodontist here